Civil society organizations known for advocating for improved health services have discussed health and climate change ahead of the COP28 in Dubai starting this November. The meeting that attracted the health and environment management sectors deliberated on mitigation and adaptation as a vehicle to cushion the country against effects of climate change.
The changing climate conditions, especially the rainfall patterns, has led to a geographic range of malaria vectors expanding, putting more communities at risk. Uganda is also experiencing a heightened frequency of extreme weather events, including floods and droughts. These events not only directly impact health, but also disrupts the health infrastructure and services.
Uganda is currently undertaking a vulnerability and adaptation assessment study to guide the formulation of a health national adaptation plan. Dr. John Bosco Isunju of Makerere School of Public Health says there is a likelihood of increased disease burden due to drought and floods.
To what extent is the health workforce vulnerable to floods? And to what extent is the health workforce vulnerable to storms or heat or water level rise? So this is slightly different from the flooding. The flooding may happen over a short time. This is just a demonstration of what happened, an impact that just described in Kilembe. So this is what happened in Kilembe. The hospital swept away.
Currently, Uganda needs up to $28.1 billion to implement adaptation, mitigation coordination, and related activities. Unfortunately, it can only afford $4.1 billion. In their health and climate change position paper ahead of the COP28, civil society organizations and private sector players want government to finance the health sector.
And so there is a financing gap of about 24 billion US dollars for us to achieve a climate-adapted society. And therefore, this symposium will also make recommendations on how we can, as a country, access financing that will continue help in building climate adaptation for the health system, but also for the country at large.
Representing the Permanent Secretary, Minister of Health, Dr. Herbert Nabaasa, underscored the need for collaborative efforts to cushion the health sector against effects of climate change.
Many of these diseases, and even the recent outbreak of Ebola, COVID, and others, are all connected to climate change. So we are putting our heads together to look at how we can put strategies to improve the resilient health systems to be able to reduce the impact of climate change on health by working with a number of government partners and also mainstreaming these interventions in our programs as a country.
A 2021 Global Health and Climate Survey revealed that 70% of countries lack resources to address their climate and health needs. Dorcas Kimono, UBC News.